So the factors that made us think and rationalise for submitting the bid, the biggest one, like I mentioned earlier, after the period of low challenge and low motivation in our current jobs, the mere thought of a challenge again was exciting. The opportunity, we worked in big NHS organisations all our working life, so the thought of actually running our own business, setting our own standards and actually doing all of the groundwork was really quite enticing, albeit possibly naive at the time. Job satisfaction, as I said, was at an all-time low, and we were keen to really get that back. Both of us had healthy nursing careers and didn't like where we were actually at the moment from a job satisfaction point of view. The varied skills, the confidence in our ability to achieve this, as Michelle really said then, came from all our years' experience. We'd worked in the NHS for a long period of time, and I think the main one was that our level of clinical governance was good. We knew what the PCT would expect and indeed want from any provider from a private practice. So we really maximised on our knowledge of NHS standards when we put the bid together. We'd both enjoyed working as nurses and to be honest, wouldn't have looked at setting up a totally private business, as in leaving the NHS to work in private business alone at this point in time, or possibly any time that we'd actually thought about. But we did see this as an opportunity of still having a lot of involvement in the NHS, if we obviously were successful with the bid, and a small opportunity at improving a section of it. So we felt quite positive. We equally knew that it would be our nursing careers that we would fall back on if it all went pear-shaped. It was our safety net as well, so we still had that.
So this picture really symbolises how inexperienced we felt as we sort of went on our journey. We were a very small private business, very newly established. We were a very new business partnership as well. Although we'd worked together in a team for about 8 years, we really didn't know each other that well, and we'd never really even socialised together, so we were taking a big chance. We had no experience of business tendering and no business acumen. We relied on Google to write a business plan and for all our development, really. We were particularly worried about our employers' actions. Although we didn't come from the same... we didn't quite agree on whether it was going to be potentially a conflict of business interest or not. We knew it was definitely a possibility. So we weren't really sure how our employer were going to react to us putting a bid in for the service. So we knew that we were potentially risking our job security, that we may be forced to leave the NHS, and all the security that went with it, pensions, etc. And our biggest worry was that under the contract that the primary care trusts were offering, there was no guarantee of volume of patients coming through or any payment at all.